This is the story of Maverick versus viral encephalitis. Maverick is a retired veteran of the United States Army. These days, he stays home, mostly sitting on his couch watching TV. His home stays locked, and he rarely gets any fresh air due to his trauma during the war.
At night, he sees shadows and experiences small signs of epilepsy, a neurological disorder where electrical activity in the brain causes seizures. Although he experiences emotional stress and loneliness, he has a caretaker at home to assist him whenever he has a spiral attack.
Maverick, are you okay? What happened? Maverick!
Recently, Maverick had been experiencing persistent headaches and stiffness within his body, but ignored it.
However, his caretaker noticed his grogginess and suggested to take him to the hospital for a checkup.
What happened?
I got a headache.
Did you eat?
Nah, I can't take this. Wait, no. My head hurts.
Okay, it's probably because of the electronics that you've been on nonstop.
I don't know, but I can't take this. I need something.
Do you need Tylenol?
My
You
head's
need
about to
aspirin?
explode. I need to go to the hospital.
Okay, let's go to the hospital. Hello.
Hi.
How are you guys?
We're good, but he's not. I'm his caregiver, and he's been having major migraines, and recently his back has been hurting him and his neck, and nothing seems to be helping, and he's gotten some sleep, but it's really hard to because of his condition.
Okay.
So we wanted to see what the hospital can do at this point.
Okay. Sir, name and date of birth.
Maverick Johnson, November 11th, 1956.
All right. Thank you. So, from what I heard, I decided to test you for a fever and give you some painkillers, okay? Is that okay with you?
Yes.
At the hospital, the doctors tested for a fever and later ended up giving Maverick painkillers and antidepressants.
Okay, so from this, you don't have a fever, but with the pain that you're experiencing, I decided to give you some painkillers so you can take it when needed. All right? Here you go.
Yes, I'll take it from you.
All right.
Thank you.
Thank you for coming. Check in like whenever you have any more symptoms or if you feel better.
Yes.
All right.
You heard that? Thank you.
At home, his caretaker ensured that he took his prescribed medicine when needed. The next day, Maverick decided to take a walk in his lawn, and suddenly, he felt a slight pinching sensation, which happened to be a tick bite.
Following the tick bite, Maverick started to experience symptoms such as severe headaches, sensitivity to light, seizures, a stiff neck and back, consistent vomiting, confusion, and memory loss. Sometimes the pain in his neck and back was mild, but only when he would take his painkillers. What Maverick thought to be a severe flu was actually an inflammation in the brain, also known as encephalitis.
What is epilepsy?
Epilepsy is a neurological disorder where electrical activity occurs in the brain, which causes seizures and many other symptoms.
The virus has entered into Maverick's body and dispersed into his brain, causing the brain to eventually swell up. The body was already experiencing immune responses, but now with the infection, the body is experiencing infection responses. So, with a combination of responses, the symptoms are more severe. Maverick and his caretaker have arrived at the hospital again. this time for more significant reasons.
His caretaker, Marie, described to the doctor the numerous symptoms that Maverick has been experiencing along with the tick bite. After hearing from Marie, the doctor inferred that Maverick may be experiencing neurological trauma.
So she suggested that they use neuroimaging, like a brain MRI and a CT scan, to identify malfunctions within the brain and properly diagnose Maverick.
She also suggested an electroencephalogram, or also known as an EEG test, to search for seizures and significant patterns of electrical activity in the brain, and blood and urine tests to identify organisms or antibodies responsible for an infection.
Some neurological trauma, and what I would suggest is we do an MRI and CT scan to identify what's going on in the brain. Additionally, I suggest an EEG scan, which identifies any seizures or electrical activity in the brain. And lastly, I think we should do some blood and urine tests to identify like any antibodies that are responsible for infection. Are you okay with that?
Yes. Not very okay.
Are you sure?
Yes.
All right, so we'll get that.
Thank you.
No problem. Okay, so your results came back, and I regret to inform you that Maverick here has been diagnosed with viral encephalitis. I'm sorry.
What is that?
What is an EEG test?
An EEG test is a test used to track seizures and to track all the electrical activity in the brain.
How did the doctor conclude that Maverick was facing neurological trauma?
So originally, when Maverick and his caretaker came into the office, the doctor came to the conclusion that he might be facing like neurological trauma because of the symptoms that he's been feeling, which affected his head. So after using the CT scans and the MRI scans, the results came back, and they noticed, well, the doctor noticed an infection inside the brain. So therefore, the doctor concluded that neurological trauma has entered the brain due to the infection that they found.
The doctor told Maverick that his symptoms are connected to his central nervous system. He explained that since the tick in his body was carrying a virus, the virus itself entered Maverick's bloodstream, where it quickly multiplied to his axial parts of the body, which are the head and neck.
Now, there isn't any natural remedy specifically to fight viral encephalitis, although there are natural remedies to fight back the symptoms such as inflammation, dehydration, vomiting, etc. So there are natural remedies and natural vitamins that could be taken to help reduce those, but there isn't any specifically to fight back the disease. The only natural suggestion for fighting back this disease would be to eat cleaner foods and have a better diet, drink a lot of water, which is recommended if you have any disease, really. But there isn't specifically a natural resource that would help fight viral encephalitis. Now, usually patients, depending on the severity of their case, would usually only take weeks to stop inflammation and see progress in the right direction on fighting the disease. But in Maverick's case, Maverick would have to continuously take the medicine for a longer period of time because of how severe his brain damage is and also how his blood test came back to be. He would have to take these antibiotics for a couple of weeks and will have to be heavily monitored to make sure that they won't have to increase any dosage due to something getting worse. Due to the amount of antibiotics patients are being put on because of this virus and the side effects of having it, they will only have to take antibiotics usually once to mostly as high as 2 times a day because the digestive system and the immune system are heavily sensitive and introducing new non-natural aspects into the atmosphere as they're fighting and trying to break down natural resources from the better diet that patients are on to help the immune system fight this disease naturally. It wouldn't make sense to add too much antibiotics, which will negatively affect the patient's progress.
Viral encephalitis is an inflammation in the brain that is usually caused by viruses. Encephalitis can be triggered by any other factors such as bacteria or fungi, but since we're talking about viruses, viral encephalitis can come from like infected insects, contaminated food, and infected people. Once the virus is inside the blood, the virus migrates up into the brain where it disperses and multiplies. And once it's there, then the body conducts like a immune response, and that causes the brain to swell up, also known as inflammation. Since the body is conducting two responses, which are the immune response and the infection response, they combine together to create the symptoms generally for viral encephalitis.
Symptoms of viral encephalitis disease includes headaches, seizures, high fevers, sensitivity to light and bright lights, fatigue, confusion, and vomiting. And these can vary in extreme measures, so it depends on the time in which you've gotten the virus and at what stage in point of time that you have the inflammation. So people who have the inflammation within their brain for a longer period of time obviously have worse symptoms than those who had just recently gotten the disease and have been diagnosed with the disease. So it gets worse over time. And the symptoms of viral encephalitis, there's the fatigue, stiffness in the back of the neck of the person due to the inflammation in the brain, which controls the nerves and the neurons. So since the nerves and the neurons are damaged, there is muscle fatigue since they're not able to send the messages to our muscles to be able to move it. So it's immobile, and during that immobility period, muscle fatigue starts to occur and take place since it's not being moved, and it just gets worse since it's not being moved. The signals are affected and damaged by our brain, and this also contributes to memory loss, paralysis, and sometimes, depending on the severity, people who's diagnosed with viral encephalitis can be can be in a coma. So it really varies and it depends, but it's all mainly because of the nerves that's damaged from the inflammation inside the brain. Because without those nerves and neurons, your body wouldn't be able to send messages to any other part of our body, which relates to almost all the systems, because the brain is what tells the body basically what to do.
So viral encephalitis generally affects younger children or elderly people due to their weaker immune system. And some complications that can occur if not treated would be hypotension, lower oxygen levels, permanent brain damage, and even death. There are two types of viral encephalitis. The first type is primary encephalitis, which occurs when the virus involves only the brain and the spinal cord. On the other hand, secondary encephalitis is when an infection spreads to the brain from another part of the body. So in this case study with Maverick, we are focusing on the secondary viral encephalitis. Magnetic resonance imaging, also known as an MRI scan, is a type of scan that engages in the use of magnetic fields to produce detailed images of inside the body. An MRI scan is generally used to detect tumors, inflammation, blood supply, blood vessels, and more. In a brain MRI scan, your brain, blood vessels that connect to your brain, your skull and facial bones, structures in your inner ear, your eyes and their tissues, and other nerves are shown. So in this MRI finding shown on the screen is an example of an inflammation in the brain.
After the doctor diagnosed Maverick with viral encephalitis, they recommended and prescribed several antibiotics and some therapy. Now, there aren't actually a whole bunch of antibiotic options the doctor could have gave Maverick that fought this viral disease in particular. The antibiotic that the doctor prescribed Maverick specifically to fight the virus is Encyclovir, which is an antibiotic used to fight viral diseases. It's very common. The remainder of the antibiotics the doctor prescribed to Maverick are due to the side effects and symptoms of having the disease, such as seizures, inflammation, viral eye infections, dehydration, and etc. For example, the doctor prescribed Encyclovir for the viral eye infections due to having viral encephalitis. The doctor then prescribed corticosteroids for the inflammation and paracetamol for preventing dehydration due to the amount of antibiotics Maverick would be at one time. The doctor finally recommended therapy for the muscles because they are spazzing a lot as Maverick is having the seizures. So that is the only physical treatment available for Maverick due to him having this disease. Due to the severity of Maverick's illness, the doctor did state that Maverick would have to take these antibiotics over a longer period of time compared to other patients that usually only take weeks for this disease to clear up. Maverick has brain swelling, inflammation in the brain, and his blood test came back as having an infection in the body as well. So over time, these symptoms should hopefully reduce because of the antibiotics. Now, usually patients are on heavy watch as they take these antibiotics due to the brain swelling aspect of having this disease. In Maverick's case, he has to be heavily surveillance because of how severe his brain swelling is. He is also a way older patient, so the brain swelling mixed with just the natural wear and tear of his body over time, especially since he has been in the military, makes his case more risky, even though he's on all the other antibiotics as well. Also, taking that much antibiotics at once isn't really common and could really mess up his immune system, which will also make the disease more effective because there's nothing naturally in the body to fight back the disease. Therefore, Maverick has to be heavily surveilled by the doctors and his caretaker to make sure that he is not getting worse. He also has to eat and be very hydrated throughout this process. The antibiotics would tear up his stomach if he doesn't eat enough food and eat the right foods, because his digestive system and immune system are heavily connected, and if he isn't eating food that's easily broken down, and that could also help the body strengthen its immune system, then he is putting himself at fault. As he's taking all these antibiotics, it will cause high dehydration. That's why he is taking the paracetamol, and so he has to keep hydrating himself and make sure that he is constantly drinking water and no other liquid. That is why Maverick must be heavily surveilled throughout this time.
But did you guys know that viruses act as if they know exactly where they're going? And they actually do, as if they have a mind of their own, but they really do not have a mind of their own. Viruses, in fact, do not have a brain like we do that includes neurons and nerves, but instead they have a main agenda of where to infect when entering our body systems. So, for example, when the virus was infected into Maverick, it had an agenda which was to go to the brain and cause the infection. So each type of virus and different types of viruses actually have a different area that they infect. And I find it very interesting how each one does something different, and it's not just by random or wherever it's located. It actually has a main goal and target in that section or portion of wherever it's located. So the main type of virus that's most known to be connected to viral encephalitis is herpes simplex virus, which actually targets the frontal temporal lobes within our brain, and it affects the motor function of the brain. So that's the main goal that type of virus, that herpes virus, affects. But there's many other different types of viruses that have different accomplishments and goals to take over within our body.
So we have reached the end of our informative slides, and now we're going to provide a summary of what occurred during the slides and the case study. So the case study focused on Maverick and his battle with viral encephalitis. Basically, he found out that he had been experiencing some headaches and a fever and seizures and muscle fatigue and confusion and memory loss, right? He never knew what it was at first, but decided to go get checked out by the doctor. So the doctor basically originally suggested that he take painkillers to suppress the pain. So when he arrived at home, he took the painkillers, but he was still feeling very groggy. So he went to the hospital again, and this time the doctor suggested that they do some tests, like an MRI scan and a CT scan and an EEG test, right? So they did that, and when the results came back, they found that he has viral encephalitis, which is an inflammation inside of the brain. As a group, we've learned that the symptoms that Maverick was experiencing is connected to his central nervous system, right? So the virus that was from the tick entered into in Maverick's body, and it multiplied into his axial parts of the body, which is the head and the neck. So he felt fatigue and stiffness, which is due to the inflammation in the brain, which controls our nerves and neurons. We also learn that a side effect of viral encephalitis is homeostatic imbalance. So an example that we use in the case study is when the doctor was feeling very warm in the room while Maverick was feeling cold. So the doctor inferred that there was something wrong with Maverick's thermoreceptors inside his body. So we learned that there isn't much natural remedies to cope with this virus. However, there are multiple antidepressants that can be used to cope with this virus that could like suppress it or, prevent dehydration. Attached to the Google slide, we have a link to our case study, so feel free to check it out.